Okay, well, let me get all set up here. This is my episode, so I get to do what I want. Oh, shit, I need my notes. Duh. There's fucking paperwork for everybody who says I don't know what the fuck I'm doing. I'm just joking. Okay, before we begin, I want to take a moment to ground us. I'm speaking from Hamilton, Ontario, on land covered by the Treaty of Between the Lakes and the traditional territory of the Haudenosaunee, Anishinaabe, and the Mississaugas of the Credit First Nation. This land has been cared for by Indigenous people since time immemorial, and it continues to be home to Indigenous communities today. I name this because harm reduction, overdose, and survival do not exist outside of colonialism. The systems that criminalize drug use, create housing insecurity, and allow people to die are the same systems that are built on land theft, displacement, and the ongoing violence against Indigenous people. As a former drug user and a harm reduction worker, I've walked alongside Indigenous communities as they have been disproportionately targeted, over-policed, and abandoned by the same systems that claim to protect us. Acknowledging the land also means acknowledging that overdose deaths are not accidents. They are political decisions made within a colonial system that decides whose lives are worth saving. If you're listening and this feels heavy, you're allowed to pause. Take care of yourself first. This podcast exists to tell the truth about what's happening on the ground and to honor the people we have lost by fighting for something better for the people that are still here. You know, you think you'd have your shit together. This is episode 0, the trailer of this podcast. I'm your host, Kayla Hagerty. I am a 27-year-old former drug user, harm reduction worker, daughter of someone who died of a drug overdose death, and the founder of a 24/7, 365 harm reduction outreach group operating in Hamilton, Ontario. My half a decade long research experience stems from losing my dad 3 months into the COVID-19 pandemic, during a time when social disruption collided with a pre-existing public health emergency. The COVID-19 pandemic increased overdose rates during the pre-existing opiate epidemic in Canada. I have come to learn through my research that there is a word for this. It's called a syndemic, and it's the collision of health crises. Anyways, I'm sick of talking politically, I'm sick of talking professionally, but I really do want to share my story. My name is Kayla Hagerty. I grew up in Hamilton, Ontario. My mother's name is Rosemary, my father's name is Chad, my real dad's name is Chad, but I have a stepdad, and his name was Ian Harrington. Ian Harrington was a criminalized individual. He was tried and found guilty of manslaughter, and he spent 8 consecutive years across several penitentiaries across Canada, including the SHU, Canada's most high-security prison. He has spent time in solitary confinement. He was suffering with tremendous amounts of mental health issues, and he was an active drug user throughout my life. I have always been born and bred on the principles of harm reduction, but I did not always understand how deeply embedded these practices and policies actually were in the professional scheme, in the outside world. I grew up believing that helping others was inherent to every human being, and as I grew up, I met others that really did not feel the same way. I experienced love that was conditional, trauma bonds, abuse. I grew up fast. I was exposed to things that most children are not exposed to. I have been orphaned by the system. My father lost his life from an overdose death, not because of our moral failures as families to keep our families safe, but because of systemic neglect and violence perpetrated against people who use drugs. So let's go back. In 2006, my dad was being investigated and was in jail or in prison, I can't remember which one, for the murder of somebody. Maybe I shouldn't mention them. This murder led to my father being held for 8 consecutive years, as I said, in multiple penitentiaries across Canada. Most of my childhood consists of long hours of traveling to find my dad, to go see my dad, to go to the prison where he was locked up, dehumanized, stripped of his rights and freedoms, and laid out to me as somebody that has animalistic tendencies, locked in a box, treated with no dignity or care. Seeing my dad like that, somebody who is supposed to be a patriarchal, strong figure in your life, is dehumanizing for me in itself. Having my father's name plastered across city news, a Canada-wide warrant out for his arrest, significantly impacted my childhood. I was unable to maintain friendships because I was a safety risk as a child of a criminal. I didn't come to this work from a distance. I have lived experience with mental health struggles and addiction. I've used drugs. I've injected drugs. I've injected fentanyl. I've injected crack. I've injected coke. I've injected meth. Anything that you could think of that you can one-up me with, I guarantee that I have done it. I have lived in a space where stigma and shame try to convince you that you're disposable, that your life doesn't matter because you choose to use drugs. I'm not sharing this story or my life story or the stories of these people to shock anyone. You know what's happening because you're complicit too. I'm sharing it because people like me are erased and expected to be silent and take the treatment instead of fighting back. But it's been histories and decades, millenniums of us fighting back that has led to our resistance and our livelihood still being maintained to this day. Harm reduction is an act of civil disobedience. I'm currently on Suboxone. Suboxone gives me stability, it gives me safety, it gives me the ability to stay alive long enough to heal. Medication didn't numb me, it gave me my life back, and I need people to hear this. Being on illicit substances, using drugs does not make you a failure. It is not a weakness, it is healthcare. When access to medications are restricted, people die. Cocaine and opiates are medications just as much as the rest of them. This is not a moral issue. It's a political one. This podcast exists because I'm tired of lies. The lies that overdoses are unavoidable. The lie that people who use drugs don't care. The lie that policy is neutral. No, policy kills. And people who use drugs have been saying that for decades, but nobody listens. My grief, it pushed me into research, into drug policy, into harm reduction, but it also pushed me deeper into my own path of destruction. Grief and addiction are not separate. Trauma and drug use are not separate. We live in a society that creates pain and suffering and punishes people for how they choose to survive it. What you'll hear in this podcast, well, it's monthly themes, so harm reduction, housing and encampments, policing and criminalization, healthcare access, peer work and burnout, grief and survival. But there's a lot of unstructured episodes as well. Episodes where people like me come on and rant, grieve, name harm, name people, name the change that they want to see. Because sometimes you don't need a theme, you just need a mic and a platform to get your word out. This podcast is for people who use drugs, people who used to use drugs, people who are currently unhoused, who experience homelessness in their life, peer workers, outreach workers, families, people who have lost someone to overdose, people harmed by policing and healthcare. This is what happens when drugs are criminalized instead of regulated. When access to care is restricted, that's political. When life-saving services are defunded, that's political. When safer supply and medications are debated while people are dying in the streets, that's political. When medication is treated as a privilege instead of an adequate aspect of healthcare, that is political. Every barrier increases overdose risks. Every delay is costing lives. Over 50,000 people across Canada have died since numbers have been recorded in 2016, since the public health emergency was first set in Vancouver, BC. You don't understand. Anybody who knows something and doesn't do anything is deeply wrong. You don't need credentials. You don't need clean time. You don't need to be polite. You just need to have lived experience. You need to have a reason to want to come on here. Too often decisions are made about us without us. Budgets, policies, programs. People who use drugs are excluded and then blamed for the outcomes. This podcast is rejecting that. Nothing about us is not just a slogan. It's a fucking demand. If you're listening to this and you use drugs, you fucking matter. You matter. You matter to me and you matter to this world and you matter in politics because you have every right to have a say than anybody else does. If you've lost somebody, your grief makes sense. You have the right to be angry. If you're angry, you should be. Overdoses are not accidents. They are political. We are living in a genocidal war on people who use drugs. We are drug war survivors. And survival, staying alive in a system that makes living hard, is resistance. If you have lived or living experience with drug use, addiction, or overdose across Canada, but specifically in Hamilton, Ontario, your story deserves to be heard. This podcast is created by people who use drugs for people who use drugs, and we're looking for guests who want to share their experiences surviving or navigating addiction, the realities of overdose and grief, challenges with harm reduction healthcare or housing, thoughts on drug policy and political change. There's no credentials required, no clean time required. You can come here high, you can smoke while you're talking to me, you can poke while you're talking to me. I don't care. I want to hear what you have to say. I love you and I care about you and I want you to know that. And I want other people to know who you are because you deserve a voice just as much as anybody else. You just need lived experience and the courage to speak your truth. My name is Kayla Hagerty, and I'm a Hamilton-based harm reduction organizer, founder of the Solidarity Alliance of People Who Use Drugs, and the creator and host of ODs Are Political Hamilton. I have lived experience with drug use. I'm open about my recovery journey and my failures as a human being. My approach rejects shame-based narratives and recognizes recovery and harm reduction and all forms of use as personal, non-linear, and deeply political. This work is shaped by grief. My father died from an accidental opiate overdose death during a time when 98% of the overdose deaths were accidental. The numbers don't lie. The facts don't lie. This loss, it fuels my commitment to ensuring people who use drugs are heard, protected, and valued while they're still alive. And I'm fighting against an avoidable death rooted in criminalization, stigma, and systemic neglect. Alongside my lived experience, I hold a master's degree in sociology, focusing on drug policy. This grounds the podcast in both frontline reality and a structural analysis of drug policy, policing, housing, and healthcare. ODs Are Political Hamilton exists because overdoses are not accidents. Survival is resistance. They are political. My name is Kayla Hagerty, and this is ODs Are Political Hamilton. This podcast is created by people who use drugs for people who use drugs. And I want to be clear, this is not a recovery podcast. This is not a cautionary tale. And this is not about proving we're good enough to deserve care. This is about truth and survival, and the fact that overdoses are not accidents. They're political. My dad wasn't a statistic to me. He was my father. And like so many families, we lived with the constant instability that comes with poverty, criminalization, stigma, and systems that punish instead of support. Later in my life, I would come to understand that what my family experienced wasn't personal failure. It was structural violence. For a long time, I internalized the idea that I was broken, that I needed to hit some imaginary bottom, that suffering was just part of the deal, part of the cards that I was dealt in life. It wasn't. What actually helped me was access to care. I'm currently on Suboxone, a life-saving medication that gives me stability, safety, and the ability to stay alive long enough to want to rebuild my life. Suboxone didn't fix me. It gave me room to breathe. Medication didn't take anything from me. It gave me my life back. And I want to be clear about this too. Being on Suboxone or using drugs is not a failure. It's not a not real recovery, and it's not something I owe anybody an explanation for. It's my right to access healthcare. That loss changed everything for me. His death wasn't inevitable. It wasn't fate. It wasn't because he didn't care enough or try hard enough. It was because the drugs are toxic. It was a result of criminalization, stigma, incarceration, and lack of access to safe supply, medication, and care. When medications like Suboxone and Dilaudid are hard to access, people die. When heroin, cocaine, and methamphetamines are not regulated and easily accessible, people die. When safer supply is cut, restricted, policed, people die. When housing, healthcare, and dignity are treated as rewards for good behavior and docile subjection to colonial laws instead of rights, politically entrenched rights, people die. Those deaths are political decisions. Every barrier increases overdose risk, and we know that. Every funding cut has a body count, and we know that. That's why this podcast exists. ODs Are Political Hamilton is a space where we tell the truth that doesn't make it into policy briefings or press releases. Some episodes will be interviews, some will be rants. I want people who use drugs, people who are unhoused, peer workers, outreach workers, and people impacted by overdose to come on this show and say what they're never allowed to say publicly. No respectability politics, no cleaning up our language, no requirement to be palatable, no credentials, no recovery time, no clean time. You don't need to perform for these people. I don't need your gratitude. You just need lived experience and the reason to give a shit. Canada loves to talk about compassion while continuing policies that literally kill people. Over 50,000 Canadians have died since 2016. That's only when they started counting the number of overdose deaths in the country. We are told overdose crises are tragic, but not urgent enough to fully fund safer supply. We're told that treatment matters, but not enough to make medications easy to access. We're told to care, but not enough to listen to people who actually use drugs, who are the experts in their own healthcare. They have been surviving this crisis for decades. We talk about how policy decisions are made, who they serve, who they abandon. Across Canada, overdose deaths were already rising long before COVID-19, but the pandemic definitely made everything worse. In the first year of the pandemic, studies found that opioid-related overdose deaths in Canada nearly doubled compared to the year before. In Ontario specifically, emergency calls for suspected overdose deaths increased more than 50%, and fatal overdoses increased about 60% after COVID-19 hit. That's not a coincidence. That's a policy failure. The overdose crisis got worse during the pandemic for clear reasons. Nobody who used drugs was consulted in the emergency response implemented during the pandemic. We were neglected. They disrupted our access to services. Harm reduction services, treatment programs, counseling, drug checking, peer support were reduced, closed, or harder to reach, and people who needed that care couldn't get it. And we still see these delays and closures today. Increasing social isolation, so physical distancing meant people who were using drugs had to use drugs alone. No one there to reverse an overdose with naloxone or call for help. That meant that 1 out of 4 deaths during the pandemic occurred when nobody was there to intervene. Even though just years before, the government was piloting this project saying, don't use alone, carry naloxone. A more toxic, unpredictable supply happened because border disruptions and supply changes made the illegal, unregulated drug market even more volatile, often contaminated with powerful synthetic opiates and other sedatives that make overdoses harder or impossible to reverse, and withdrawal symptoms almost impossible to survive. Mental health supports basically evaporated, so the supports that we had that helped people cope with anxiety, depression, trauma, stress just disappeared overnight. That left many people isolated, unsupported, and at increased risk. And the lack of connection to community that happened during the pandemic when peer networks and social supports shrink. People have fewer protections, fewer spotters, fewer people sharing strategies for staying safe, community care, and these compassion clubs like Dolph's. This is what keeps people alive. Resistance is what keeps people alive. They policed our resistance. They policed our connections with community so much that we died. This is political. My father didn't die because of stigma alone or because drugs are dangerous. He died because systems that should protect people, healthcare, housing, harm reduction, were not accessible. Because treatment was near impossible to find, and when it was available, it's conditional and stigmatizing, dehumanizing, policed. Because the drug supply is violent and unregulated. We remember what happened during the alcohol prohibition era. We remember the deaths, the blindness, the liver failure, all of these things that occurred that made the government step up and regulate substances. Every death that happens is a result of neglect, a set of political decisions that choose punishment over care, criminalization over compassion, and scarcity over access. That's why I do this work. That's why this podcast exists. So it's January, and my birthday is today, January 14th. And I just want to talk about how people freeze to death in Hamilton every year. And that's not because of the weather. That's because of policy failure. So let's talk about encampment evictions in the winter. When we create barriers to care, we run into things like criminalizing people for displaying their mental health issues. When people go to a shelter, or when people say, just go to a shelter, what they're really saying is change who you are to deserve the support that you need and to deserve safety. There are so many shelter barriers for people who use drugs that if you're caught using drugs in a shelter, you're deemed unworthy of access to housing and are left to freeze to death in the cold. Warming centers are not enough. Warming centers are a great band-aid option, and sure, the funding for warming centers was a great idea that I brought to council a couple years ago, but after some fucking thought, I realized if you have so much money to fund a warming center, then you have enough money to create affordable housing and hire people to create a supportive transitional housing program that can have harm reduction measures inside of it. The same operations that exist in the warming center can exist in a housing complex where families can live, where people who use drugs can be taken care of, can take care of themselves, and can stay safe. The City of Hamilton's encampment protocols, let's go get an update on that, shall we? Together. Let's talk about first what an encampment actually is. An encampment in Hamilton refers to one or more people living outdoors in tents or makeshift shelters on public or private property, often due to lack of affordable housing, shelter capacity, or other support options, just not being a viable option for them. So, an encampment for people who are homeless is a survival tactic. It is a commune. It is a community of people who are dedicated and dutiful to watch each other's backs. There's a group called Keep Six in Hamilton, Ontario. And Keep Six means, in Army terms, watch my back. What people who use drugs have been doing in these encampments is creating communities where drug use and displaying mental health issues and being actively homeless is not frowned upon or shunned away, but welcomed. They're creating a safe community, a network of people that are relying on each other for survival. Hamilton lies. They claim their outreach first, that there's a coordinated encampment response team, that they're rights-based and person-centered, staff approach with dignity and confidentiality, but then go on to raid encampments alongside police and destroy communities. Access to health and social needs with consent and everything. These things can exist in housing. If we were to stop funding response teams and start funding the actual solutions, like providing support including transport, storage of belongings, shelter access, financial help, and connection to housing services, these site cleanups and encampment raids and sweeps would not have to happen. People would be in safer spaces. There would be no litter or abandoned items if we would just give people places to fucking live. In March 2025, Hamilton, around the same time that safe injection sites were closed, Hamilton rescinded its previous encampment protocol, and it now enforces the city parks bylaw that prohibits camping in parks. Residents or advocates can report encampments to CERT, the previous peer-orientated, rights-based, person-centered engagement crew. Now are acting as cops. You can report encampments for investigation, and then the police will monitor parks, manage safety concerns, and ensure that the bylaw is being followed. Enforcement actions have brought dozens of sites into compliance with the bylaw, which means that dozens of people's communities have been actively destroyed in Hamilton, Ontario. This is a shift to stricter regulatory posture and policy. This is a policy decision. Hamilton's approach has been upheld by the Ontario Superior Court. The court found the city acted within its authority and struck a balance between public safety and access to homelessness and supports. This means that this is an active political decision. They know the cost of this. They know the bodies piling up in the streets because of homelessness, and they're choosing to do this. Legal interpretations, such as whether individuals have a right to stay and have a right to overnight sheltering when shelter beds are lacking, are continuously shaping policy debates. We need to get our voices out there because our civil disobedience, our delegations, and our voice will be the voice for change. The city doesn't treat encampments in isolation. It's part of a larger homelessness prevention and ending strategy. There's a 10-year plan called the Housing and Homelessness Action Plan in Hamilton, Ontario, which is recently under redevelopment, which is supposed to guide Hamilton on how to address homelessness system-wide, emphasizing partnerships with community groups and service providers. But no homeless or drug-addicted individuals were consulted during the creation of this strategy and action plan. Hamilton aims to bring a system where homelessness, like if it can be prevented, becomes rare, brief, and non-occurring. Significant investments have been made to expand emergency shelter space and recognizing the need for immediate alternatives to encampments, like the Tiny Homes Project. But 2 people have died because of a lack of education and a failure to hire people who know what the fuck they're doing. Harm reduction workers let 2 people die of drug overdoses in a supportive housing project. The city's protocols are not universally accepted. Advocates argue that policies centered on enforcement and bylaw compliance can criminalize homelessness, and they do not address root problems like affordable housing shortages and the lack of supports in the city, and calls for The calls persist for sanctioned encampments, peer-involved outreach, and low-barrier options that keep people like me safe while long-term housing is secured. Being homeless is not a moral failure. This conflict, it just shows the tension between public space management and rights-based human services. This is a core theme in this podcast. Now, let's talk about overdose rates in this city. So the podcast is called Overdoses Are Political Hamilton for a reason. Let's talk about Hamilton's overdose crisis, which is higher than the provincial average. Hamilton has consistently experienced higher opioid-related death rates than the Ontario average, 46% higher in 2024, due to largely the highly toxic, unregulated drug supply, especially fentanyl and additives like metamethadone, xylazine, benzodiazepines. Drug-related deaths peaked around 2021 to 2022, and they've shown a slight decrease in recent years. There were fewer deaths in 2024, but the burden remains significant and sustained. There are around 22 to 24 deaths per 100,000 people in Hamilton, Ontario. And our what's that word called? Our population is about 580,000. Wait, yes, that's the right way to say that. Among people experiencing homelessness in Hamilton, opioid-related death rates are extremely high. Over 1,000 per 100,000 compared to 16 per 100,000 for those in private dwellings, highlighting the tremendous housing-linked vulnerability. There are hundreds of overdose and EMS responses each year. For example, in 2013, paramedics responded to over 900 suspected opioid overdose calls. What Hamilton is doing and not doing to address the overdose harms. So there's a lot of city-led harm reduction services. There's naloxone distribution and training. There's the Van Needle Syringe Program, which distributes clean injection supplies, clean inhalation supplies, naloxone refills, and referrals to health and social services. The mobile outreach van run by the Positive Health Network delivers these supplies and supports drop-in services within Hamilton, and they accept used needles in return for safe disposal. There's a lot of street health clinics. Local clinics provide wound care, STI testing, referrals to housing and treatment, overdose prevention, education, and harm reduction supplies. There's a drug checking program, I'm pretty sure, or there was supposed to be a drug checking program at Hamilton Urban Core. There was also supposed to be a safe consumption site at Hamilton Urban Core, and yet they shut it down. One of the most controversial and impactful harm reduction interventions, supervised consumption or injection sites, has had limited implementation in Hamilton. Hamilton's supervised injection site feasibility study found that the city would benefit from one or more supervised consumption services due to the high overdose and infection disease rates in the city. However, there was no established permanent licensed consumption site in the city with a full Health Canada exemption like Vancouver's Insight or Toronto's sites. All we have is a safer use space that's funded not by Health Canada, that operates within the YWCA, that is only for women and gender and diverse people. Meanwhile, the overdose rates in Hamilton show that the most impacted population in terms of death rates are males. In contrast, Ontario's provincial policy environment in recent years has gone to restricting supervised consumption sites. Proposed legislation requires distance buffers from schools, limiting the opening of new sites, and closures of so many services and sites across Ontario. Why does this matter? Evidence shows that supervised consumption sites prevent fatal overdose deaths on site and connect people to care with zero documented deaths at any legal site globally. 0 deaths have happened at a safe injection site, but population level mortality outcomes are complex, and they depend on coverage, location, and access. Advocates argue that Hamilton needs expanded low-barrier supervised consumption services, especially given the high rates of overdose in public and private settings. You can't walk down the streets in the city without seeing somebody using drugs, seeing somebody overdosing, or seeing somebody knotted out on the ground, or seeing somebody living unhoused, a precarious housing, or experiencing a mental health crisis in public. Critics say that the city's harm reduction efforts are under-resourced relative to their need, and that the provincial policy constraints make it harder to implement evidence-based interventions like supervised consumption sites and safer supply options. There's also an ongoing debate about housing as a core determinant. Without stable housing and low-barrier treatment, overdose prevention remains limited. And also, the increasing police budget in Hamilton, Ontario, and the militarization of police, the criminalization of human beings in distress. Why are we not using this money to fund treatment options if we're so concerned about sobriety? I run a 24/7, 365-day harm reduction outreach service in Hamilton, Ontario. We operate every fucking day, all night, all wards, all right. Anyways, we got naloxone kits and overdose prevention training, education on safer use, and referrals to outside services that are trusted by me, a former drug user and a daughter of somebody who died of an opiate overdose death, okay? If I wouldn't access these programs, I'm not sending you there. Street health clinics, van needle syringe programs that I can connect you to, drug checking initiatives, Positive Health Network, the van you can 905-317-9966, text or call, treatment and support lines. There's local mental health crisis support lines like the Barrett Center, MASH. Call me if you need my help. 365-889-5464. Let's talk about closures in Hamilton, Ontario, and how that's impacted Hamilton residents. There's a very popular discussion going around in the social media life and political life and just like outside world that there's an increase in people who use drugs in Hamilton, Ontario. There's an increase in overdose deaths in Hamilton, Ontario. And a lot of people are like, what the fuck is going on? What's divisive, what should be dividing you guys, is allowing preventable deaths to continue while avoiding political accountability. Naming outcomes, like naming what's going to happen while these politicians actively allow us to die, isn't just me making shit up. It's not inflammatory. It's me being honest. Treatment and harm reduction are not opposites. People need to survive long enough to access treatment, and closing these safe injection sites makes that less likely. Some leaders have objected to how plainly we have named the consequences of site closures, and I want to be clear, your discomfort with people who use drugs and people who are homeless is not the same as me being inaccurate. These deaths are real. People don't stop using when these sites close, they just die. In 2025, provincial legislation was implemented that required supervised consumption sites across Ontario, including Hamilton's Urban Core Community Health Centre location, to close because they were within 200 meters of schools or licensed child care facilities. The law forced these closures by March 31st, 2025, despite evidence that they saved lives and provided critical harm reduction and health services. Locally, Hamilton's Supervised Consumption Service has provided thousands of supervised consumption visits and wraparound supports prior to this closure. City Council had previously voted to call on the provincial government to help keep the supervised consumption site open past 2025 deadline, recognizing their importance for overdose prevention. But after the closure deadline, a provincial ban led to the supervised consumption site in Hamilton ceasing operations and transitioning towards the Heart Hub model, which does not include supervised consumption or drug checking, even as public health alerts noted rising opiate poisoning shortly after the closures. So let's talk about what's actually happening here in Hamilton in 2025. A supervised consumption site that had been saving lives, reducing harm, and connecting people to services was forced to close under a provincial rule about arbitrary distance from schools, a rule that nobody asked for, and that directly contradicts what frontline workers and public health data has been saying for decades about how to keep people alive. Hamilton City Council even voted to ask the province to keep these sites open past that deadline, and yet the site still closed, the very thing that kept people alive in this city. So I want to challenge the leaders responsible for that decision. When the evidence shows that these services prevented overdose deaths and kept people connected to care, why did you still let them go? And what metrics will you use now to show that replacing them with a different model caused fewer harms than actually maintaining them? Responsibility isn't going to be erased by your jurisdiction. I don't care if you're a municipal government, a federal government, provincial government. Decisions at the municipal and health leadership level, like how you responded to the closure, how you advocated for continuity of care, and how you have planned for its direct consequences, this affects people who live or die. This is a political thing. We're investing in the new Heart Hub and other services to support people, and investment in services is welcome, but it's not a substitute for services that have already been proven to directly prevent overdose deaths and keep people alive. Replacing one model with another while removing the most effective harm reduction tool doesn't reduce harm. It redistributes where the harm is happening. Now you're seeing it right outside your door. And if you say this rhetoric is divisive or me making it a political thing is wrong, it's not. Like, this decision is considering neighborhood concerns and community safety. True community safety includes keeping all people alive. Harms from a poison drug supply and using alone don't disappear when you shift the language, they just increase. We have data from public health that overdose risk spiked after the supervised consumption site is closed. Point blank, period. We followed the law. It wasn't personal or political, but laws are political by design. Laws are part of policy and politics. Choosing to enforce or enact a law that removes life-saving services in the middle of an overdose epidemic is a political choice, and its consequences are measurable in these ambulance calls and deaths. It's not an abstract rhetoric. It's happening. If you know anything about the history of drug laws, you know that prohibition is state violence. Decriminalization is not enough. We need a regulated supply. We need compassion club models. We need peer-led models in harm reduction. We need people to step out of our way. We are dying. We have no time to debate. Even if you've never used drugs in your life, you witness the outcomes of these policy failures on a daily. You've witnessed repeated overdose deaths. You've witnessed paramedics being called for overdoses, naloxone being administered, naloxone fatigue, withdrawal, moral and mental distress. And what do you think? What prevention do you think would actually change any of this? If the criminalization and prohibition measures that have been in place since drug laws have been enacted aren't working, then what is your idea? It's harm reduction. It's humanizing people who use drugs. It's decriminalizing and regulating the substance of drugs that people have been asking for since the 1900s when drug laws were enacted. And the problem is, all of these laws would have been implemented properly in the first place if media didn't shape policy response and if stigma didn't supersede statistics. If we had solidarity with drug users in the beginning, our understanding of addiction and our policy work would have been shaped to work with them instead of against them. These deaths could have been prevented years ago had we listened to drug users during the AIDS epidemic who were telling us that this saves lives. Harm reduction saves lives. We cannot have grief without blame. We need to blame the system, because if we don't, we begin to point the blame at the wrong people. The victims of this genocidal war on drugs are the people who use drugs. We are not the perpetrators of violence. We are the ones being violated. The stories that don't get told are the ones that need to be heard, and those are the ones that are going to be seen and heard from in this podcast. The political risk versus the human cost. This might make you uncomfortable, but it is definitely necessary. It is definitely necessary to have these conversations because this exposes how decisions are actually being made. Governments often say they're concerned about overdose deaths, but based on my work, concern without action is a political strategy. When people talk about the opioid crisis, they usually talk about numbers. They talk about trends, they talk about costs, but they don't talk about fathers. My dad's name was Ian. He wasn't a statistic when he was alive. He was a person who laughed loudly, loved deeply, and struggled quietly. Before COVID-19, the opioid crisis was already killing thousands of people across Canada every year. It was already an emergency. But when the pandemic came, it created a new crisis. It collided with the one that had already been ignored for decades. Overnight, services closed. People were told to isolate, forced to isolate. The drug supply became more toxic due to border closures. People began to die alone. I watched this happen from every angle. I was a harm reduction worker responding to overdoses in the middle of a global lockdown. I was a graduate student researching how COVID-19 was changing substance use and survival. I was an advocate speaking to the media, warning that what we were doing wasn't enough, and it still isn't. And then I became part of the story in a way I never expected. I fell in love. I lost my job. I crossed lines that systems draw easily, but personal lives do not. I developed my own addiction to crack cocaine and fentanyl and became an IV drug user while working inside a crisis designed to burn people out and discard them. But today I am alive. I'm on Suboxone and I carry the weight of having seen this crisis from every side. The worker, the researcher, the person who used drugs, the person who survived, and the child of someone who didn't. This podcast is not about what COVID-19 did to the opiate epidemic. It's about what our governments choose to do and not to do when faced with a mass preventable death crisis. 5 years later, the question isn't whether we know better, it's whether we are willing to act. Nothing will change until people who use drugs are allowed to speak. This has been ODs Are Political podcast. Thank you for listening. Before I leave you, I want to be very clear about something. Overdoses are not accidents. They're not moral failures. They're not inevitable. They are political. They are the direct result of policy decisions, decisions about whose lives are worth protecting, whose deaths are tolerated, and whose suffering is ignored until it becomes inconvenient. In Hamilton, we are told there isn't enough housing. We're told harm reduction goes too far. We're told supervised consumption sites are controversial. We're told people just need to make better decisions. But what we're not told, what we're not allowed to say out loud, is that this system is working exactly as it was designed. People who use drugs are expected to disappear quietly. People who are unhoused are expected to stay out of sight. And when they die, we're expected to accept it as collateral damage. I won't accept that. This podcast exists because people are dying in a country that claims to care. Because grief keeps piling up while solutions get delayed. Because harm reduction workers, peer responders, and people who use drugs are doing life-saving work with scraps while our government debates optics. ODs Are Political Hamilton is not about neutrality. It's not about balance, and it's not about respectability. It's about truth. It's about naming the systems that kill and the people who survive anyway. It's about listening to drug users, not managing them. It's about refusing to let our dead be reduced to a statistic or a cautionary tale. If you're listening to this and you've lost someone, I see you. If you're listening to this and you use drugs, you matter and you deserve to live exactly as who the fuck you are. And if you're listening to this and you're uncomfortable, good. That discomfort means something is breaking through. I mourn the dead and I fight like fucking hell for the living. This is ODs Are Political Hamilton. I'm Kayla Hagerty. I'm 27 years old and I'm not fucking finished yet.